Welcome, everyone, to the Privacy and Security Expert Roundtable Blab. I am David Harlow, otherwise known as Health Blog, and I have with me today Rick Kam from ID Experts and Niam Yaragi from the Brookings Institution. Our final guest was unable to make it today due to a work issue that needed his immediate attention, and that was Larry Poneman, whose institute has released this week the 6th annual benchmark study on privacy and security of healthcare data, which we'll be discussing with Rick and Niam. Rick's been involved in the development of these studies and reports since their inception 6 years ago. And Niam has released a report through the Brookings Institution in the past week or so that is also relevant. But before we dive into the content here, I'll just give a brief introduction to Blab, the platform we're using, and how we would hope you'll be able to interact with us today. So if you've found us, that's great. Here we are. And as you listen to us over the course of the hour, please, if any one of us says something particularly wonderful, you can give us some props by clicking the pair of hands in the lower right-hand corner of the speaker. And if you have questions, please feel free to send us a message in the lower right of the screen. And there are slash commands that you can use. If you do a /Q, I believe, your question will pop out of the queue and into the question queue, makes it easier for us to see it. So with that, hopefully the technical details will be self-explanatory beyond that. Oh, also, if you particularly like something that you see, or if you'd like to share this blab with other folks as we go, there's a share link in the upper left-hand corner. And you can also certainly just share out the link to folks. And this blab will be archived and available at this URL for replay. So with that, let's turn to the subject matter at hand, which is the ever-popular topic of healthcare data privacy and security. I spend a great deal of my time on this issue, as I know my guests do as well. And again, they have both issued reports recently which are of great interest in terms of tracking where we are today, both in a sense quantitatively and qualitatively. And as we'll get into the discussion, you'll see that one of the report is more of a quantitative report and the other more of a qualitative report. But before we dive into the specifics, I'd like to ask my guests, how did you arrive at the, how did you get the folks to answer your questions? I mean, who are these folks? There's a broad range. There's a wide variety of folks who are the subject of breaches and investigations and audits and so forth, and certainly many more than the number of folks that you were able to speak to. And I'm just wondering how you focused in on the ones who you did get to through your instruments.
So let me start first. My target population were the organization who had experienced a breach in the last 2 years and were listed on the OCR's website. So I wanted to have a representative sample of the 3 different kind of organizations, which are healthcare providers, business associates, and insurance companies listed on the OCR website. But others, I realized the fact that it is not easy to bring people and persuade them to do an interview, because they were much more reluctant to talk about their experiences than what I felt. At the beginning, I was under the impression that, when I approached them as an independent researcher from a neutral institute and ensure anonymity, then they would have no problem talking with me. But I was proven wrong. We spent countless hours, not only me, but also a group of researchers trying to, get on phone with these people and use any kind of method that they can legally use in order to persuade these people to talk with us. And only 22 of them were willing to talk with us.
Right.
Mm-hmm.
And Rick, do you have a sense of how we got to the group of business associates and covered entities addressed in the Ponemon Institute report?
Yes, David. Let me give you a little background. So, Dr. Larry Ponemon has been doing research in the area of data privacy and data security, I think, for 12 or 13 years. So he's got quite an outreach to various organizations that have been part of many of his studies over the last several years. When this particular study came about, we and many others in the industry were very interested, curious, maybe a word for it, but more specifically interested and concerned that there wasn't a lot of information from a qualitative perspective, as you say, in the industry. I know, Niam, you mentioned that it's difficult to get to people who are willing to talk about a specific incident their organization has had, where there's been a breach that's been publicized, or a cyber incident, or an intrusion. Fortunately, Dr. Ponemon has quite a combination of reputation, number one, but secondarily, an approach that he uses to reach out to literally thousands of organizations who have participated in a variety of studies with him. This particular study, I think he reached out to 1,100 or 1,200 organizations. He got somewhere, I think the numbers are 89 or 91 covered entities and 89 business associates, organizations to participate. They range in size from large hospital systems to clinics and providers, as well as payers and others in the industry under the classification of business associate that work with securing protected health information. And the concept of a benchmark as opposed to a questionnaire is rather unique. So instead of sending out or doing an email survey necessarily, this is a very in-depth conversation with a number of people, 4 to 5 people from each institution that participated, that range in roles from the chief privacy officer, the information security officers, the CIOs, the CEOs, others that have a role in protecting data privacy and security in this environment. So I think he talked to close to 1,000 people, and used an instrument that he's used with us with this particular survey before to get a trend, if you will, over the last 6 years.
So what's the trend? We're spending a lot of money on security and so forth, and certainly throwing a lot of resources at it. Is it enough? Are things getting better?
Yeah. So as Dr. Ponemon and I have done dozens of interviews with people that are interested in the research report up to this point. Yeah. And David, like you, they're interested in what's different because it does track a series of trends. What the report highlights is there is still a very high number of breaches occurring in the healthcare environment. 89% of these organizations surveyed experienced at least one breach in the last 2 years. A significant number, I believe it's 79%, had seen 4 or 5 breaches in that period. So what's interesting is that the number has not actually gone down over the last 6 years. It stayed about the same. And that's what's surprising, given the amount of investment and focus that's occurred, Niam, as you say, from HHS and OCR, as well as the industry itself investing, billions of dollars in trying to protect this data.
Right. So, so things continue. There's a combination of said generically, sort of, sloppiness. There are things that people could do better. There are also sort of criminal attacks. There are there's always the case of the disgruntled former employee or the person after some celebrity salacious celebrity health data. So, I mean, to me, I mean, my sense in dealing with these issues over the past number of years in my practice is that the biggest issue is not a technical issue. It's more of it's human factors. And some of those human factors can be addressed through training. I mean, certainly the technical infrastructure needs to be there, as well as organizational policies and procedures. But ultimately, it's a question of training. It's a question of culture, and I'm wondering if that's something that you saw, Niam, in your interviews. You had highlighted human error as well as a key cause of breaches, and I'm wondering whether the folks you spoke with had acknowledged that directly and sort of what they're doing about it.
Yeah, if there was only one thing that all the people that I talked with agreed upon was exactly the same thing that you pointed out. Human errors are the most common problem out there and is the most challenging problem to address because we can pretty easily, if you have the money and if you have the will to address them, we can easily address technical problems. If you need to have a, better encryption system, or if you, need to install more expensive firewalls, or even increase your physical security, it's possible to do that. And when you do that, you can sleep at night knowing that you have done what was necessary to do. And as a result of those efforts, the likelihood of breach, at least through those channels, would be completely eliminated. However, human errors, you mentioned training. If you do all the training in the world, you still cannot be sure that your employees in your hospital or in your insurance company or wherever are never going to make a mistake or do an error, or are going to comply with the policies and trainings that you had designed for them. So I like to acknowledge the fact that, yes, human errors is the most problematic and the most common error that is happening and is leading to privacy breaches in the healthcare.
Yeah, actually, Niam, can I add a little bit to that? Because
Sure.
I think, what we found in the surveys over the last 6 years is, as you said, the human error, basically the good employee making basically a dumb mistake has caused, roughly half of the data breaches in the industry. But there's been an interesting trend that's occurred that we've seen in the data just over the last few years. The number and severity of criminal attacks, those attacks by hackers in some cases, nation states in other cases more recently, have really increased over the last several years. In fact, since Dr. Pohnman started doing this study 6 years ago, it's more than the criminal attacks have more than doubled. They've increased 125% in the last 4 or 5 years, with now the criminal attacks being the second year where it's been the most prevalent and actually the most damaging of the breaches that have occurred.
So let me add something else. The criminal attacks can happen, I think, through at least two main methods. The very first one is that a hacker tries to, infiltrate your network through, sophisticated hacking attacks. The other, which is, could be prevented through investment on security technology. You make a more secure network, you reduce the likelihood of that hacker, succeeding in penetrating the network. The other type of hacking and criminal attacks happen through phishings. The guy sits at home and sends you thousands of phishing emails, and ultimately one of your employees may click on the link that they shouldn't click. So it is, again, a criminal attack, but at least in part, it's human errors are contributing to that.
Right, that plays into that, and that I think is a good segue to sort of what can people do, and some folks do this and others don't so much, but there is the concept of the risk assessment that is maybe not 100% required under the HIPAA regulations, but obviously a good idea to do, security assessment, a risk assessment rather, when initiating any compliance program, when changing any aspect of the program. And part of that risk assessment will lead you to uncover some of these issues, including these human factor vulnerabilities. And then, you need to get into appropriate kind of training and testing, including penetration testing. And part of the penetration testing really needs to be some fake phishing emails, I think. I can't remember if one of you had included that in your writings. But Rick, other thoughts about what sorts of testing ought to be done both on the systems and on the people?
What I'd say, David, is, as Niam said, you can invest all kinds of money in technology to try to prevent a hacker or some intrusion into your network. Last year when we were looking at the data from the fifth annual study of the Ponemon report, one of the things we had seen essentially is organizations like Anthem, Blue Cross Blue Shield, Anthem, Primera, Care First, Excellius, and whatnot, essentially finding that they've had malware in their systems after they looked, right? They had a company called Mandiant Forensics Investigation Company come in and look. So one of the things we were thinking and we still think to this day, is one of the areas of investment one could make is essentially coming in and assuming you may have already been breached, right? From one of the situations that Niam mentioned, and actually trying to figure out if there's currently malware or other things, ransomware now, that might be in your system that might be triggered at some point.
Right. And you mentioned ransomware. There's sort of an open conversation currently about whether a ransomware incident is a reportable breach. And I noticed that Devin McGraw said recently, I think you were at the same event, Niam, in DC. She said that her office will be releasing, that's HHS Office for Civil Rights, will be releasing guidance in the near future on the question of ransomware. And it's been reported, I wasn't there, but it's been reported that she also said that, from her perspective, at least some ransomware attacks would be considered breaches. And, I would agree. Some would be considered breaches, not necessarily all.
Right.
I understand ransomware. I'm not a technical guy, but again, from what I understand, I think some would not. Have you seen an increase in ransomware? I mean, we see it in the popular press, but I'm wondering whether this has been, the iceberg where so much is unseen because folks do not see this as a reportable incident.
You want to tackle that, Niam, or you want me to jump in on that?
Go ahead, please.
Yeah, so I may have been at one of those events you guys were at where either Devin McGraw or one of her cohorts, Ileana Peters, was talking about this very situation. What's interesting about ransomware, as you mentioned, David, is a lot of people are considering the fact that the data has been encrypted, right, and not necessarily stolen or removed from the premises, as potentially helping them avoid having to notify consumers that there's been a breach or fall afoul of the state or federal breach notification laws. One of the things that I picked up in Ileana Peters' comments on this about a month ago was that there's different conditions that meet a unauthorized disclosure under basically HIPAA and high-tech, one of which is unauthorized access to the data. And as we started to dig around that concept a bit, if you think about access, it turns out someone accessed the system, right, and was able to find and identify those particular files that that they would want to encrypt, that would have some value to the organization. And the other things that the more current versions of these ransomware attacks are revealing is that the ransomware and the attackers are actually destroying the backup files. So if you have a backup file somewhere in the system and you have a ransomware attack, if you're able to restore that backup, it basically reduces the probability that the organization will pay the ransom. So the bad actors are realizing this, and they're not only destroying the backups, but I've heard they're also destroying the log files. The log files being, the trace of which files were changed, who came into the system, when, and so forth. So what Ileana Peters said is, if really the burden of proof on an organization as to whether a breach has occurred or not it really falls on the organization itself. And if you can't prove when they came in, what files they touched, who accessed the system, basically you may have a situation where you have a notifiable breach.
Right.
Well, the other point that I want to add to this is that, as we know, this ransomware attacks, not specifically for healthcare industry, but in general, these are not a new phenomenon. They've been around for such a long time. But the healthcare industry has become a favorite target for such attacks very recently for a couple of reasons. The very first one is that the healthcare has become more reliant on its IT networks, because now everybody is using EHRs and the healthcare has become digitized. So they rely on their networks so much that they cannot operate without them. This recent ransomware attack in MedStar hospitals near us at DC, they were turning patients away, because they couldn't work without their network. So now that more hospitals are digital, and basically means that there are higher number of potential victims out there that hackers can attack. And the other one is that not only there are more potential victims, but also victims rely on their digital networks so much that they are more willing to pay the ransom. So it's a perfect rational and economic choice from the perspective of the hackers to focus their attacks on the healthcare industry, especially when we have lower security investments at the healthcare industry as compared to the other sectors. So I guess the banking industry and the financial industry and retail industry have much better security technologies in place to prevent becoming a victim of such ransomware attacks in the first place.
Right. The other thing, until we get David back, I guess he went out for a cup of coffee or something. But this issue with ransomware, as you said, it's been around for years. But I think what's happening is the sophistication of the attacks has increased tremendously.
Absolutely.
So in the past, it would be more difficult for them to essentially extract a ransom. And that's why the FBI in particular has been warning the healthcare industry about these particular attacks and the potential damage they're causing.
Absolutely. The availability of Bitcoin, I think, has played a huge role in there. When you can ask people to pay you without, having any concern that payment could be tracked back to you, and law enforcing agencies such as FBI or other agencies would potentially be able to come get you, then it would have some preventive effect. You don't want to give somebody your bank account and ask them for ransom. But if it's possible to ask for ransom through Bitcoins, and rest assured that nobody would be able to, track you and find you, then.
Yeah, we seem to have lost Niam. I may be alone on the video. Well, while we're waiting for both David and Niam to come back, I'd be happy to give you a little bit more information on the Ponemon Institute and the report that was published yesterday on May 12th. One of the other findings that occurred, that came out of the research, was that there seems to be finger pointing between the covered entities and the business associates as to who is causing the major breaches. And basically, the covered entities pointing at their business associates in some cases, and the business associates pointing at their covered entities as being the problem. One of the reasons why I believe this is occurring is because of the lack of accountability that may be in the industry itself in terms of who is accountable to protect this data in the first place. Hey, David, are you back? Okay, well, in the absence of David, I'll just keep on going. So the other piece of finding in the research essentially was that the organizations were identifying that as a result of these breaches, there was much more medical identity fraud occurring.
I don't know if you can hear me, Rick.
Yes, I can, David. Yeah. I can hear you. Can you hear me? Yeah. Can you hear me, David? Let me see if I can. He's trying to. Hold on, folks. For those of you that are out there, David's trying to dial back in, and I believe Niam is also trying to do the same. Yeah, but in the meantime, while David's trying to get back in, if you can hear me, gang, I'll just keep going. The other thing around identification of the fact that there are patients falling victim to medical identity theft and medical fraud as a result of these breaches is that there's been some number of these organizations that are unwilling to essentially provide tools, whether it's monitoring tools or other things, to help stop or help these individuals identify that they're now falling victim to this problem. So it's kind of a combined problem. David, are you back?
I think I'm back. Sorry about that, folks.
Yeah.
Great. I had wanted to turn to the question of whether HIPAA is a ceiling or a floor, and that's something I wanted to raise with Niam, and I think he's dropped off as well, unfortunately. Some of the questions and comments described in your respective reports sort of focus to a great extent on HIPAA, but obviously HIPAA is a floor. There's been a lot of feedback from folks who Niam spoke with, who said, the government ought to tell us something more specific, and then we'll just do it, and then we'll be okay. And I'd like to hear your reaction to that.
Yeah, I guess, Dave, well, two reactions. One is I don't think HHS, or some agency within the government saying just do it is going to be helpful, just because of the complexity and the diversity of the types of organizations that are in healthcare in particular, but in other industries. I do think your comment about HIPAA being a floor is appropriate, though. And I believe HHS and OCR are providing guidance on what good and reasonable data security looks like. As you're well aware, they point to NIST as an organization, for example, and the framework, security framework that they prescribe as being useful. We had a great conversation with Joan McNabb, who's the Chief Privacy Officer as part of California's Attorney General's office. They're actually publishing a list of 20, I guess you'd call it good recommendations, or recommendations so that organizations that they engage with that are typically, small businesses, clinics, small providers, have at least a go-to in terms of the things that they should do to make sure that they're more secure or have reasonable security, I think is the term she used. I think there's a lot of good tools out there outside of the federal government and the state governments. HITRUST is another source for a framework. So there's many pieces of the puzzle that can be filled in with a lot of these frameworks. And to your point,
Sure.
I don't think it's the government that can edict what's the right one.
Right. And I've seen, there's certainly a lot of uptake of HITRUST as a standard, and it may in fact become a de facto standard as large covered entities basically require HITRUST certification over a period of time of their business associates, right? So that's headed in the direction of becoming a de facto standard. Have you seen that as well in the folks you're working with?
Yes. There's several of the consultants, whether it's the Booz Allens, the Deloittes, the IBMs of the world, are teaming and or advising that you go down that path.
Mm-hmm. Right. Yeah, and it is quite a path. It is something like a couple years worth of activity in order to get that actually done.
Mm-hmm. But this is where the work that the California AG's office, for example, Joan McNabb's work, comes in handy for those organizations that aren't those giant organizations or larger organizations that have the resources. The smaller clinics, the millions of doctors' offices that have one or two or three, some small number of practitioners. They also need a framework to work with that's not going to take one of them offline for 2 or 3 years.
Right. Now, something that you said recently in the follow-on to releasing this report, Rick, was that maybe folks would like something like Sarbanes-Oxley. I don't want to put words in your mouth. I think that's something that you said.
That's exactly what I said.
Where, you get to make somebody responsible personally. They have to sign their name to an attestation of some sort. Yeah. And that may get folks to take all of this a little more seriously.
So let me give you a little more background on that, David. So I came out of the financial services industry recently. It was about 12, 13 years ago, when Enron and WorldCom and other organizations like that were causing a little havoc, with the economy in general. And one of the things that I saw personally was the implementation of Sarbanes-Oxley and the impact it had on solving some of those problems. And as I've talked to people, even including the Ponemon survey, where we're getting this situation where there's finger pointing, people not necessarily taking responsibility or pointing their fingers the other way. I believe the issue around this is around accountability. And what struck me was the most effective aspect of Sarbanes-Oxley, from my perspective, was the fact that the CFO basically would have to attest to the fact that they, in the case of a HIPAA construct, if they attested to the fact that they reviewed the risk analysis that you mentioned earlier, and that they made appropriate investments in risk mitigation tools, processes, policies and whatnot in order to address those, and they had to sign their name to that fact,
right,
I think we'd have a tremendous impact on some number of organizations because people would care.
Right. Welcome back, Niam. We were just talking about getting people to care and following up on Rick's call for something like a Sarbanes-Oxley type attestation by a responsible party within a covered entity or a business associate. And more generally talking about the idea of HIPAA as a floor rather than a ceiling, and things like HITRUST certification as an issue.
So let me just add something. I absolutely agree that HIPAA is the floor. It can never be the ceiling. As one of the people whom I interviewed with put it, HIPAA just shows how security nerds were thinking about privacy 20 years ago. And unfortunately, it has become very difficult to rely on HIPAA and what it recommends in order to ensure the privacy and security of the health records, given the advances that we have observed during the past couple of years in terms of technology.
Right. So I think related to the question of should there be some other regulatory step taken to require something along the lines of this attestation. And let me pause right there and say the idea of getting Congress at the moment to do anything productive is kind of a non-starter. So I'm
Right.
not very hopeful. One thing that you had mentioned in your report, Niam, which I found interesting, is the observation that government incentives led healthcare organizations to adopt EHRs without really being ready to invest in security adequately. And there was obviously the HITECH Act was part of the legislation that brought us to the proliferation of electronic health record technology, but at the same time, did not necessarily move people in the direction of implementing the security requirements beyond the risk assessment that may have been required as part of meaningful use certification. Rick, I don't know if you could speak briefly to the question of meaningful use risk assessments versus broader HIPAA risk assessments.
Actually, I wanted to follow up on one of the points you made on the legislation piece, because I want to, what's the right word? Support the fact that we're probably not going to get something through Congress, for the next little bit. But, where I've seen some of the most innovative legislation come through is from the states. So as you know, the first breach notification law to protect consumer privacy and security came out of California with Senate Bill 1386 many years ago. And there's a lot of movement among all of the states, or many of the states, to update their breach notification legislation. And so, if one of the states or a few of the states rally around the idea, ideas to change legislation that might have a positive impact, I think we'll get some movement on that. And so, if any of our listeners out there today have a particular state congressman or somebody who they think a state representative might be receptive, I'd be happy to come out of Portland and come and visit and take this conversation to another level and help move something forward.
Excellent. Great. Rick, we have a question for you asking whether you can provide an example of some individual monetary loss or medical care interruption as a result of a healthcare data breach, sort of questioning whether we've overstated the premise, the concern for healthcare security.
Yeah, that's a great question. So there's actually a couple places to look for data points on this. One of them is a study that Dr. Poneman published over the last 5 years, I believe, around medical identity theft with an organization called the Medical Identity Fraud Alliance, also based in DC. There's research findings in that particular report that indicate the number of people falling victim to medical identity theft, the particular impacts on them, both financial as well as healthcare related, as well as the other damage that they incur around reputation if they have something particularly sensitive in their health record that they may not want to disclose to their employer or to the general public. The other, quite honestly, are organizations, not only like my organization that deals with healthcare organizations that have breaches of protected health information, but also public nonprofits like the Identity Theft Resource Center in San Diego, California. They help victims of identity theft, including medical identity theft, respond to and resolve those issues specifically. And I guess I could share with this particular listener, there is a number of people who have been victims of a breach of protected health information that are affected, both from, in some cases, most cases is financial, because that's really, one of the areas of opportunity. But I would tell you there's some of the largest breaches that we've ever worked on that have released protected health information. Things like whether you have mental health record issues mental health issues that are recorded in a background investigation report, for example, or drug issues. There are literally millions of people in the U.S. whose medical records have been released, who, when combined with other information, whether it's a breach of LinkedIn, for example, or a breach of Gmail, where these criminals can combine data sets to figure out who's who in the zoo, if you will, can cause some tremendous damage, not only financial but other damage.
Right. And we've seen certainly stories of medical identity theft where folks have proceeded to have medical procedures of significant expense performed on them and basically billed to and recorded as being performed on somebody else.
Right.
And then the real kicker in some of the reports I've seen is when the person whose identity has been hacked and whose benefits have been used for a surgery is then denied access to his or her medical record on the grounds that it includes PHI that belongs to somebody else, and therefore can't be revealed to the rightful owner. Thankfully, as far as I know, the government has stepped in cases like that and has mandated the release so that the person is then able to disentangle the bits and pieces, right? So you don't want to have somebody with inaccurate medical record attributed to them, right?
Yeah, David, one of the issues, I mean, literally, I heard a story yesterday of a victim of medical identity theft where it was essentially a teenager who was in a sport who got injured. Hi, Niam. Looks like you're back. Good to see you.
Yeah.
But he was playing a sport, got injured on the field, was taken to the hospital because the medical records. The doctors realized the medical records were inaccurate.
Yeah.
The net of it was it delayed the prognosis and diagnosis of what was wrong with this teenager. The end result, unfortunately, was he had a brain aneurysm. So, before the incident, he was a healthy teenager playing soccer. After the incident, he was a healthy teenager with the brain of a 4-year-old because of the delay in the diagnosis.
Right. Yeah, that's awful. So we need to remember, of course, that privacy and security of these records is intended to serve the patient. And obviously there should be an exception in case of emergency. And this relates to some other thoughts about information surfaced by your reports, which is basically one of the things that we really need to learn in healthcare is that in a large institution, perhaps not everybody needs full access to everything. And that is the sort of permissions environment that leads to a number of breaches. The counter argument, of course, is, hey, I don't know when I'm going to be on, floor 10 and I'm going to need to help out in a code and I'm going to need to access so-and-so's record. And my response to that is, well, you can have sort of a break the glass functionality, right? So in the ordinary course, you don't have full access to everything in an institution. But of course, in an emergency, whether it's the kind of emergency you describe or the kind of emergency I'm thinking of within an institution, that someone can have full access to information when needed. In your travels, have you seen folks implementing anything like that?
Absolutely. There's actually several organizations that are implementing, I guess you'd call them behavioral tracking systems of sorts. So they're looking at the normal behavior and activities of the doctors, nurses, the participants in in the hospital working through their day-to-day work, and it will call out an exception, a flag, a situation where somebody is doing something that's not part of their normal activity, like coming in at an hour, time of day that they're not normally there, perhaps accessing records that they don't normally access for periods that are too long, those kinds of things.
Yeah, or high volume sometimes.
High volume,
yeah.
Right.
Yeah. So one of our viewers is commenting that we're making a great case for regulatory measures, and I would beg off. We see so many times a situation where something happens and the reaction is there ought to be a law, and something bad has happened. And nothing can be done because there isn't a law that covers that exact situation. And maybe we're sort of on the edges of that with the ransomware situation in terms of HIPAA enforcement, although, as you said, there may be state rules that come in there. But my attitude is I like the idea better of sort of a flexible standard like HIPAA, because then the implementation of that standard can evolve over time. If we have something that's 100% black and white, then we're sort of stuck with that.
I agree with you.
Yeah. Okay. The sense of some of the folks who Niam spoke with is that they were looking for more certainty, I think. Do you see that in your travels as well? People hoping for some certainty and direction as to what they need to do exactly, rather than.
Yeah, I do actually. The whether it's in litigation, the Federal Trade Commission in particular has brought a few cases on deck where organizations are looking for whether it's the Federal Trade Commission or HHS to provide what is this, the minimum standard or reasonable standard of security. And I don't think that's going to happen. It's like you said, organizations are so diverse. They need the flexibility to be able to determine what appropriate technologies, processes, policies and whatnot fit their unique circumstances. And I think it's getting more complex versus less, right? There's more diversity with companies now that in the medical app space, developing tens of thousands of healthcare apps. The Internet of Things, the Apple Watch that I wear, that isn't an advertisement necessarily. But, people are wearing various devices that are feeding information into servers consist on a minute by minute basis. So I think there's a multiple front here. There may be a little adjustment we can make in some of the legislation to help with accountability, as we talked about earlier. I think awareness of the potential problems, data being leaked, so the consumers care more about protecting their own data is important. So they have to take responsibility for protecting their information. And I think the institutions themselves just need to continue to try to make the right investments and take the right steps forward in protecting data. And we'll see some hopefully positive impact over the next few years.
Right. So let's see. Other things we ought to be talking about here. So I guess the real question for all of us. Oh, one specific comment to pick up on something you just said is in the question of the not HIPAA governed realm of personal tracker data, to the extent that it's not something that's going directly to a covered entity. Sometimes you get those trackers from your health plan or from your doctor, but more often than not, that's a consumer purchase, and that's personal information, but not protected health information. Right. And I think there's we've come to understand that there's a broad misunderstanding in the public that such information and the applications that deal with that kind of information on their smartphones, those things are not subject to HIPAA. But I think people have an expectation that they are subject to some sort of privacy protection. And of course, they are. They're subject to some Federal Trade Commission rules and some other agency rules in general. But many of the device manufacturers, many of the app developers out there, publishers out there, have not really engaged in the same sort of approach to data privacy and security as the HIPAA-covered community has. Have you seen sort of the situations where the covered entities are trying to do business with the non-covered apps and devices of the world? Is there a steep learning curve for some of those folks?
No, I wouldn't say that. I think there's some awareness. In fact, the Ponemon study that we've been talking about has some statistics on awareness of some of this. But in general, what I've seen, David, is most organizations care, and if they're made aware that the data that they're collecting could potentially cause harm if it's released, they reached out to us in some cases and other organizations in the industry to try to figure out how to deal with this more efficiently, because nobody wants to be at the back end of a data breach and have fingers pointed and say you caused this. So, but I think the thing that, the blog that you're doing, the work that you're doing, and many others in the media around this topic is so important because it raises the awareness not only for the community of people like that are listening today and others that will listen to this blog, but hopefully as consumers, legislators, others pick up on this and care, basically.
Right. We certainly hope that people will continue to care. I think what you said earlier about sort of state level regulation is something worth pursuing. I mean, at the risk of having sort of the 50 state patchwork, which drives some people nuts, because in this day and age we have a national marketplace or a global marketplace, and every time I hear from a client with what sounds like a simple question, I say, well, I have to do a 50 state analysis for you. Really? Are you kidding me? That's sort of a problem. So, certainly wish we had a more functional Congress, and maybe we will one day again. But there's certainly some interesting things happening at the state level in different parts of the country. You mentioned California in particular. There have been some others recently. One thing that came across my desk recently was a Tennessee rule that now says that in some cases release of encrypted data would be considered a breach. What do you think? I guess I'm just sort of opening this up for general comment. I mean, is it possible to go too far? I mean, I think in some cases, yeah, sure, it's possible to go too far. Is something like that too far? Does that sort of push us over the edge? Or there was something out of Texas a couple of years ago where people said, well, if you're doing anything anywhere in the country, you're going to be subject to Texas rules. Maybe overreaching in some measure. What else have you seen around the country that maybe caught your interest that you think is either spot on or going too far?
Well, this whole area of potential new legislation that could potentially overreach, just because of the complexity of, as we talked about earlier, not only the complexity of the systems that are involved, but the diversity of the organizations. I think one of the more important and potentially clarifying things that's going on is as an example, is the attorney generals around the 50 states have put together a cybersecurity, data privacy, internet security committee. So 10 of the AGs sit on this committee, and they basically look at these types of situations that are going on with large multi-state data breaches. And one of the things they're looking for is how to protect their consumers, those that are involved in or impacted by a breach. And I think it's going to be efforts like that where you bring together, smart people, in this case, the attorney generals from around the country who have a concern and around not only data privacy and data security, but their constituents who will help harmonize, these in some cases the complexity of the legislation, but more specifically, what is the right thing to do with this particular organization that breached this data for the consumers that are impacted.
Mm-hmm. Mm-hmm. So, Rick, if we have a few minutes left, and Niam has sent me a message saying he wasn't able to get back on, but he's live tweeting as we continue to talk here. Because we're multi-channel environment here. If you were working with an existing client or a new client today, and you wanted to sort of go about creating a, as much as it's possible to do such a thing, sort of a bulletproof privacy and security environment. Are there some things that stand out in your mind as priorities for an organization?
Well, having seen the back end of a breach, one of the things that we're thinking, which actually comes out of Dr. Poneman's report, is actually the response that's almost more important than it is the preparation to protect the data, because the organizations that respond effectively to a cyber attack or to the loss of protected health information, or disclose, intellectual capital or corporate secrets, is how they respond, is how they're perceived by the regulators, their consumers, the attorneys general, and so forth. So we've been talking about putting all this effort into technology, perhaps training employees and whatnot. I'm almost thinking at this point, a breach is inevitable. Organizations are being attacked by cyber hackers on a daily basis. So versus all the focus we're putting on, on the front end of this, there should be some amount of energy and resources to look at how one responds. Right.
Now, some would say, and I think some of Niam's respondents said that basically to take your argument to its logical conclusion is that them with the fanciest lawyers and consultants wins, and that's maybe inappropriate. That there should be some sort of hard and fast rules that apply to everybody, and it shouldn't be about spin, etc.
Right. Yeah. No, I would. My experience, David, is we've worked with literally thousands of organizations that have breached data. Mm-hmm. I would tell you, almost to a one, they care. They actually care about what the outcome is for the people they've affected. Mm-hmm. There's somebody on that team that's dealing with the PR and communication components of this. But in all cases, I've seen the organizations really want to respond and care about the people that they've affected. So, on one hand, it's good to have a good attorney when this happens, of course. But at the end of the day, it's how the people who have been affected are treated. And if you, as an organization, put up an effective communications call center, contact center, provide help to people who've been affected, and these people become delighted victims. They don't sue. They don't leave your organization. Mm-hmm. It's a very positive outcome.
Yeah, I would agree. It's very important to sort of manage that relationship through the hard times as well as the good times, because we're certainly going to experience these hard times. As you said, it's more a question of when than if any particular organization may experience a breach. It's just the volume and the creativity behind the attacks is just overwhelming. The exploitation of the human vulnerabilities as well as the technical vulnerabilities. Well, we just continue. We soldier on, right?
Yeah. Yes, absolutely. Yeah.
Great. Well, Rick, it's been a pleasure speaking with you today. We're coming to the top of the hour, and everyone who's been listening in, I appreciate your sticking with us. We've had some technical glitches today, but that's life, I suppose, in the big city. And we hope to hear from you online and offline in the future as you continue to think about healthcare data privacy and security. Once again, Rick Kam from ID Experts, thank you very much.
Thank you, David, for having me on.
A pleasure. And we had Niam Yaragi, a fellow at the Brookings Institution, was on for a bit today as well. He's experiencing some technical difficulties on his end. And I am David Harlow at the Harlow Group, otherwise known as Health Blog Online. Thank you very much.